Turning now to our top story, the decision by the WHO to endorse the world's first malaria vaccine. Professor Abdoulaye Djimde leads the team at the Malaria Research and Training Centre at the University of Bamako in Mali. He joins us from there now. Thanks very much indeed for being with us. Now, I know this is a field that you've been working in for years now. Tell us the significance of this move by the WHO.
This is an historical day for us in the malaria field because many of us and many of the patients, the families have dreamt of having a malaria vaccine approved one day, and today is that day. It is of utmost importance for the fight against malaria, specifically in sub-Saharan Africa.
Now tell us that the 30% roughly efficacy figure, will parents still want their kids to have the vaccine if that's the figure?
Yes, 30% is coming to be added to the other tools that we have, which is the bed net, the indoor residual spray, the diagnosis, and the care using artemisinin-based combination therapies. And this vaccine is going to actually reach a number of children that could not have been reached by some of the other tools. So it is going to be an additional and an important tool. 30% seems small at first sight, but if you look at the sheer number of children suffering and dying from malaria, preventing that in 30% is a formidable effort.
And give us an idea, I mean, you studied this illness an awfully long time, but an idea of the nature of malaria that makes it so difficult to manage or to treat.
Yes, malaria is a parasitic disease. It's a eukaryote organism, and it's very complex. It's the parasite is complex, its life cycle is complex, it changes over time, so it has been scientifically very challenging to come up with good solutions. At some point, some actually thought that it would not be possible to have a vaccine that would work against this parasite. But now with this new news, we know that it is possible. It's not the perfect solution yet, but we hope that from here, the next generations of vaccines are going to perform better. So there is hope that we can get a vaccine to prevent this terrible disease.
And how quickly do you think this current one that has been approved by the WHO can be rolled out? And is it going to be part of the kind of the batch of vaccines that kids get when they're tiny? How's it going to work?
Yeah, that is actually the important part of this pilot implementation, which was done in real life by giving the vaccine along with the normal childhood vaccine that is normally given to people, to which all children and mothers and families are accustomed to. So adding this vaccine has been seamlessly worked. The take-up has been good, the reception has been good, and so it's not going to be reinventing the wheels. This vaccine is going to be added to the normal EPI system.
How concerned are you within the context of COVID and the lack of sort of vaccines available across the world? I mean, they're obviously available in some places and not so much in others. Are you concerned that kind of the costs will be difficult to find, or it will be difficult to fund these new vaccines for malaria?
Yeah, that's what we are now worried about. COVID has shown the issue of the lack of equity in terms of access to these public health goods. So with malaria being a disease of, especially by and large, a disease for sub-Saharan African children, and given the difficulties that our countries are facing, we hope that the international community is going to stand up and make this vaccine available to the children who need it.
Professor Abdoulaye Djimde from Bamako University, thank you very much indeed for talking to us.
Thank you.